Have you ever stopped to think about when you last read the tiny print on a medication bottle without struggling? Not glanced at it quickly, not held it farther away and then closer, not searched for brighter light or asked someone else to read it for you. Think about the last time you could simply pick up a bottle, look at the label, and read every word effortlessly. For many adults over 60, that question creates an uncomfortable pause. The reason is that vision changes often happen so gradually that they seem normal. Most people assume that worsening eyesight is simply part of getting older. They believe the eyes are naturally wearing out, just like aging joints or graying hair. But that explanation is incomplete. What many people never hear is that some of the most important changes affecting vision may not begin inside the eyes at all. They may begin in the bloodstream. Every day, tiny chemical reactions occur throughout the body. When these reactions are driven by unstable blood sugar levels and metabolic stress, they can slowly affect the delicate structures responsible for clear sight. The eye contains some of the most metabolically active tissue in the human body. These tissues require a constant supply of oxygen and nutrients. Even small disruptions can have consequences over time. Yet many people are given stronger prescriptions year after year without ever being told why their vision keeps changing in the first place. In this video from Vital Aging, we're going to explore the hidden biological processes that may be influencing your eyesight right now. You'll learn what may be happening inside your eyes on a cellular level, why certain vision problems become more common with age, and how everyday food choices can influence these processes. Most importantly, you'll discover practical, nutrition-based mechanism number 4 may be the most surprising because it connects your eyesight to another organ system that most people never associate with vision: the kidneys. At first glance, the eyes and kidneys seem completely unrelated. One helps you see, the other filters waste from the blood. Yet deep inside the body, they share a critical vulnerability. Both depend heavily on extremely delicate networks of tiny blood vessels that are highly sensitive to metabolic stress and prolonged exposure to elevated blood sugar. When blood sugar remains unstable over many years, these microscopic vessels can gradually become damaged through the same glycation process we discussed earlier. The result is not only stress on the retina, but also strain on the kidneys. What affects one system often affects the other. As kidney function slowly declines, even at levels too subtle to cause symptoms, the body's ability to regulate fluid balance and blood pressure can become less efficient. Blood pressure may begin to rise gradually, often without noticeable warning signs. This is where the connection to vision becomes especially important. Inside every healthy eye is a carefully regulated level of pressure, known as intraocular pressure. This pressure helps maintain the eye's shape and supports normal function. However, when pressure rises beyond healthy levels, it can place stress on one of the most important structures in the visual system, the optic nerve. The optic nerve serves as the communication cable between the eye and the brain. Every image you see depends on signals traveling through this pathway. If the nerve becomes damaged, vision loss can occur even if the retina itself remains relatively healthy. This is the hallmark of glaucoma, a condition that often develops so slowly and painlessly that people may not realize anything is wrong until significant vision has already been lost. In many cases, peripheral vision disappears first. Because central vision remains intact for a long time, the damage can continue unnoticed for years. What makes this particularly concerning is that many people view